Dermatology YouTube channel. My name is Andrea. I'm one of the licensed practical nurses here at the clinic. Today we're talking about our Cynergy machine. Cynergy is actually from our Cynergy Laser Company. They are a world-renowned laser company. And this machine has been with our practice for a very long time. Essentially, it treats several cannot say this enough, several different conditions of dermatological concerns, from blood vessels to pigmentation to laser hair, all kinds of different things. It's definitely more of a medical type of laser. A lot of lasers are directed more towards anti-aging, fine lines and wrinkles, pigmentation, but this one is your full-on dermatology laser. So different conditions that it treats, like I had kind of said, vascular lesions. So we're talking about port wine stains. These are types of conditions that you're actually born with. So port wine stain is a very large blood vessel kind of on the face, or it can even be on the body as well. So it helps treat that. It also treats hemangiomas, venous lakes, venous lakes are usually found on the lips. It can also treat cherry angiomas, those tiny little red dots that you have possibly all over your body, which are, usually benign conditions, but they can be a little bit, unsightly. So definitely this is something that can treat that. I also mentioned it can treat pigmentation. So it helps treat some deep pigmentation because there is a part of the laser that can go very deep into the dermis. And it can also be safe for all kinds of different skin types, because it's able to differentiate between different types of pigmentation. Pigmentation from the sun, which are all really, deep inset pigmentation. It does not treat melasma, however, because this laser actually creates too much heat in the skin to help treat melasma. And melasma is one of those things that is a little bit more heat induced, so it will actually kind of pop up a little bit more. So we don't want to add more heat to a problem that's already caused by heat from the body, essentially. This also can treat warts. So if you've had that stubborn wart for a while and you've tried everything over the counter, you've gone to your doctor and got it sprayed a bunch of times, this is kind of one of those machines that kind of help out with treating that problematic wart. What it essentially does is it's targeting the blood vessel in that wart. So how does this laser actually work? So there's actually two lasers in one on this machine as well. A lot of our machines here, we do have multiple laser energies within one platform, and we find that's really helpful for our practice because we are able to actually treat so many different dermatological conditions. So this one has a pulse dye laser. Pulse dye lasers, or PDL for short, are different from an IPL, or tense pulse light. PDL is actually a laser. IPL is a light. Okay, so that's the difference between the two. Laser uses laser energy, and this actually will target and create a little bit more heat than an IPL does. So a laser light will actually go straight into its target. An IPL, or a light, will actually kind of shoot in a general area. So it's a wide branch that it goes through. So this is definitely more precise. So the pulse dye laser targets blood vessels. So it's looking for the heme in the hemoglobin. So that's essentially a molecule in your blood cells, okay? So when it actually targets that blood cell or the blood vessel, it hits it and it changes it, okay? So it takes something red and turns it to purple because it's actually targeted something that has the heme, which means it has oxygen, and it'll change it to deoxygenated. So it'll help take away that blood vessel. So we're talking about the angiomas. Another condition I forgot to mention was telangiectasias. So there's a lot of little red blood vessels, or even for rosacea, where you get the big, thick blood vessels that occur. This will target that blood vessel specifically, okay? So it shoots its energy in there. It kind of sounds like a snap, kind of like that. It's very quick. There's a little bit of discomfort when it comes to that pulse dye laser, kind of in there and out, but there is a cooling fan. So his little buddy here essentially blows cold air on the area to help really keep that area comfortable. So when it shoots that energy in there, it constricts that blood vessel, which means it cuts off that airflow essentially to it, so it doesn't have that kind of, your blood vessels are not kind of flowing through there. So it'll kind of constrict that blood vessel And as your body notices like, hey, well, these actually aren't doing what they're supposed to, it'll slowly start to kind of recede that blood vessel. So you don't notice that blood vessel on the surface of your skin, okay? So that's the pulse dye laser. The other part of this laser is called the ND-YAG. Again, you don't need to memorize these terms. That's what we do here at Edmonton Dermatology, is to know that for you. But to kind of explain it, this is the one that's targeting the deep, dark, purple, brown stuff that's in the skin. So we're talking deep into the dermis of the skin, almost all the way to the subcutaneous fat. So it's one of the deepest lasers out there that can target that far into the skin. So when it sends its energy in there, this one has a little bit more of a sting to it because it is going so deep, okay? But we're talking the really deep purple, so like that port wine stain. So if you want to look that up on Google, careful when you do, because some pictures are a bit more scary than they really should be. Most port wine stains aren't as severe as what Google shows, but essentially you can see that deep dark purple that's occurring there. So that really helps target that. Another thing it helps with is leg veins. Leg veins, that's those stubborn tiny little veins right on the surface of your skin that are blue-ish or purplish. The pulse dye laser is not able to see that. The pulse dye laser is looking for that red. This one will look, the ND-YAG will look for that purple, so we're able to target that. Same concept, there's that snap, it constricts that blood vessel, and your body slowly helps take that away, okay? With the YAG, like I mentioned, it helps treat pigmentation, so browns. Again, because there's so much energy in sending into the skin, it actually helps shake that out, okay? So it shakes that out, and almost kind of an acoustic thing where it shakes that pigment out of those skin cells from deep down there, and your skin has no other way of disposing of it, so it pushes it to the surface, and you end up with that kind of crumbly pigmentation at the surface of the skin. How does it feel? I kind of hinted to it a couple of times. There's a bit of a snap that comes with it, but it's so quick, and then that the airflow is happening that it kind of just subsides right away, okay? When you leave the clinic, you are a little bit red, okay? It's nothing severe like a sunburn, but you definitely feel like, yeah, you know, there was a bit of heat in my skin. I can definitely feel like something happened. So almost like you were out in the sun a little bit too much, but not to the point where you actually got a sunburn, okay? This lasts for probably about 2 or 3 days. Then it slowly starts to settle and kind of go away. So it's probably about 7 days. When you have a rosacea treatment, it's usually about 7 to 10 days. It tends to be a little bit more of a sensitive type of skin condition. So it slowly just kind of settles out within that 7 to 10 days for rosacea. For everybody else, it's usually about 7 days. For the pigmentation patients, like I said, you get that kind of influx of that pigmentation on the surface and that crumbliness. That will actually take more like 5 days to actually start showing up, and it takes another probably 3 or 4 days to actually kind of peel off your skin. So it's a little bit longer, so I'd say roughly about 10 days. Now, how many treatments does it take for each of these conditions? Well, because this thing treats so many conditions, it's kind of hard to say. So it all depends on when you come and present to us here at the clinic, and like I had said before, in some of my other videos, is that consultations are complimentary. So we do recommend that you give us a call, and we can certainly set that up so we can give you the proper amount of treatments and costs and stuff like that, and make sure that this is the correct treatment for you. So to give an example, for rosacea, we usually say it's 4 to 6 treatments, and we usually do them every 4 to 6 weeks apart. 4 to 6 treatments. It all depends on how severe the rosacea is, how many blood vessels we see in the skin, stuff like that. There are some patients that have rosacea, but it's light enough that the machine can't see it properly. So that's when we go to the IPL. So if you want to learn a little bit more about the IPL, I do have another video regarding our Icon laser. That is our IPL machine. That machine is also from Cynergy. Again, a great company. That platform also, like I said, has multiple different hand pieces, IPL. Take a look at that video. That's one of the ones that can kind of talk a little bit more about the IPL. So for rosacea, like I said, 4 to 6 treatments. When we're talking for wart treatments, warts take a long time. So already you've been probably struggling with it for several years. It's not something that's going to go away with a couple of treatments. Every patient is a little bit different. Every wart is more or less stubborn. It just depends on how it presents. Some patients, yay, quick, easy, no problem, you know, probably a handful of treatments. Other patients, years. So it all depends on the type of wart that's going on the foot, how big it is, how thick it is, stuff like that. For some of the other conditions like cherry angiomas is usually 1, maybe 2 treatments because they're very tiny, they're very bright red, the machine can see it really, really well, so very quick and easy. So hopefully that answered all of your questions. If you have any more, feel free to give us a call here at Edmonton Dermatology. We can certainly set you up, like I said, for a consultation to see if this is the correct machine for your concerns with your skin. Thanks so much.